I saw one when I was doing research this week, and it said, these are going to be the biggest upcoming trends in plastic surgery in 2026.
Okay.
And I was like, oh, this looks really interesting. And I read the article, and I absolutely hated it. So,
oh no.
This is one of those segments where I'm going to point out how much I hate something. This is a segment about what I think are the worst plastic surgery trends.
She looks worried.
Doesn't she look worried? I mean, whatever that guy's telling her, she's totally...
she's not happy.
She's like, what?
Her news.
What? What's going on? So this article was in the magazine Allure. Have you guys read Allure? Or it's a periodical. I've looked at some articles from them. They do a lot about aesthetics and stuff. So it caught my eye. Biggest plastic surgery trends 2026. Obviously wanted to check this out. So again, I read this article and I absolutely hated most of the predictions. I was just like, what? This can't. If you ask me what are going to be the trends of 2026, it's like picking, stocks. You don't know if they're going to go up or down. You can make a guess. If I had to guess 2026 trends, I think it's going to be continuation of 2025. You're going to see, non-invasive stuff be insanely popular. You're going to see less of, the Kardashian look and more of the ballet body, because I don't think we're done with that trend. But outside of that, it's all speculation. And I feel like they just pulled these random, some of these were plastic surgeons, some I think were cosmetic surgeons, and it's like they were all pushing maybe what they do.
Right.
I don't know. It was weird. I hated the article. So anyway, I'm going to go through it and we're going to see. So the first one that they said was going to be the new hot trend for 2026. You're going to love this one. The rebranded Brazilian butt lift.
Okay.
Yeah, exactly. So what do you do whenever the public finds out a procedure's totally bad? They just change the name. So that's basically what this was saying. So instead of Brazilian butt lift, it's going to be the fat transfer to the buttocks, which is what a Brazilian butt lift is, and this one or two surgeons saying, it's going to make a resurgence, now that we're changing the name.
Rebranding it?
Yeah, rebranding. I just can't believe they posted this.
Why did they call it Brazilian butt lift in the beginning?
Probably, I think that the first ones were done in Brazil. Brazil's a hotbed for plastic surgery. That's a good question. That has to be the only answer, is that the first ones were done in Brazil.
And rich people would be like, oh, I'm going to go to Brazil and get a butt lift.
Yeah, that has to be it. I'll look it up just because now you piqued my curiosity. But so, we've talked about Brazilian butt lifts. I hate these surgeries. I won't do them. I do fat grafting. In fact, I did some we just talked about fat grafting last week.
Did.
And I really like it for certain applications, but I hate it for the butt, just briefly, because one, mortality rates are much, much higher with that surgery due to the risk of fat embolism. Also, there's issues with...
Why is it riskier for fat embolism in your butt
versus
anywhere else?
Bigger blood vessels.
Okay.
Much bigger blood vessels.
And because you have to put so much in your
butt.
Right.
Yeah, that's another great point. In order to get a fat embolism, you basically have to take the cannula, which is remember that needle I had when we were doing this last week?
It's that big, thick thing.
Yeah, it's really thick. And the thing about it, it's blunt. Mm-hmm. Okay, so it will generally not go into blood vessels, because blood vessels are a little tougher than you think. Mm-hmm. And if you push against a blood vessel with a blunt object, a lot of times just like a hose maybe, it just kind of goes out of the way. Yeah. And also there's the issue if it's a really tiny blood vessel, like a capillary, it's just going to go right through it, and no fat's going to get into the bloodstream that way.
So the blood vessels in your butt are just perfect size.
They're bigger, yeah. So there's a more likely chance that injecting into the buttocks will get into a blood vessel big enough that the fat can actually go into it.
Yeah, that's a big muscle, so there's a lot of stuff.
Well, and a lot of it is probably technical error, because if I remember correctly, a lot of the fat embolism comes when they get too deep into the muscle. You're not supposed to inject the fat in the muscle.
Right. Supposed to be in the fat.
In the fat, right. But there are occasionally big blood vessels in the fat, like big veins and stuff. And then also, there's those big gluteal blood vessels if you got into the muscle. Mm-hmm. So obviously there's the danger. And there was somebody on there saying, oh, no, the studies that's saying that it's dangerous are wrong. And, it's because they actually started ragging on Florida and Miami and all of the little pop-up plastic surgery shops, which I agree with. They are definitely worse. That I think that a really skilled plastic surgeon is going to have a more reasonable risk profile for this, but it's still risky.
Yeah.
It's still risky. There's still the question of, are you going to have enough fat, which is a big problem. And we talked about that last week, that most people who want fat grafting don't have a lot of fat, right? And so there's just a lot of problems with it. So I hate that surgery. I'm not alone, although a lot of plastic surgeons won't speak out against stuff. I have no filter. I'll say anything I want. So like I'm saying what a lot of people think, which is this operation sucks. All right, moving on to the next one, endoscopic facelifts. So this has been around a while. So endoscopic is, I don't know if you guys are familiar with that word, but it basically means making a little small incision and putting in like a camera or a tube. It's like laparoscopy, but slightly different because you're not going into like a cavity.
Yeah.
So somebody was on there saying endoscopic facelift is going to make a huge trend. I'm going to put very doubtful on this one. I mean, these have been out a while. Like, they're not new. I do, obviously there is a trend for everything to try to become less invasive. Like, that's a real thing. And also that's going to come back around here, like the next one I'm going to say. But I mean, this has been out a while. And although it is very non-invasive, it gives pretty subtle results.
Yeah.
And so my feeling on these is, if you want that subtle result, then do something non-surgical. I mean, there's a lot of really good, tightening procedures out there that are just not surgery at all, like the Halo, Morpheus8 and all that, and they work.
Yeah.
So I just don't see that one making some big surgery.
Like the cost benefit's not there.
Right, yes, it's a lot of money for a lesser result. So it's like, I wouldn't do that. Okay, the next one just absolutely floored me. So someone was on there saying, I've never even heard of this, which granted, I'm not saying I know everything in the world about plastic surgery, but I do know a lot, especially since I've been doing it for so long. And I do this show where we constantly are looking up topics, right?
Yeah.
So somebody was saying that submandibular gland resections are going to make a surge in 2026. So submandibular gland is the salivary gland kind of right here under the angle of your jaw. And they were saying that some people need that gland actually resected to make the contour of the neck look right. And I was just like, that's like the dumbest thing I've ever heard of. Number one, I've never looked at a patient and been like, oh man, look at those submandibular glands. I mean,
you got some chubby glands.
Yeah, your glands are out of control, man. That's just great. And so yeah, I've never seen that. I mean, granted, if somebody was thin, you could probably palpate them. Like, I can't even palpate my own, and I'm definitely maybe not perfectly thin, but I don't think I'm overweight.
I can feel my glands, but I've never thought that they were in the way.
Yeah, right. And so there was people saying that, oh yeah, there's this new surgery where we're going to contour your neck by resecting your submandibular gland. Please don't do this. I mean, there's a reason that plastic surgery has lower complication rates. Is because we try to keep things simple and not overcomplicate stuff, like diving into deep muscle layers when you don't have to resect a salivary gland that could leak or cause a fistula. I mean, I don't know. I actually looked up, there are a lot of risks. This is a thing, I guess. I mean, it's not a popular thing at all, but there's enough out there. There's a couple papers that talk about the risks of it. And I mean, the risk profile wasn't insane, but I mean, it was definitely some risks. Things like I said, salivary gland leakage, salivary gland fistulas, hardening of the neck. I mean, I would never do this in a million years.
Yeah, do they mess with that, like when you get a facelift?
No, absolutely not. Absolutely
or
no.
Like a neck lift?
No,
they don't mess
no.
with it.
You're above that. So the gland sits below the muscle, and so yeah, we tighten the muscle up, and one of the things that can happen when you do a facelift is you can stick the salivary glands. There's a potential for issue of that, but like in general, like we just stay away from it. Like we don't.
Maybe they're saying it's gonna, like, instead of like people being like, oh, I had a neck lift, they're gonna be like, there was something wrong with my gland.
Right, my glands are out of control.
Yeah, I feel like that's something. Like whenever people say they got a nose job, it was because like of
yeah, right. Deviated septum.
Deviated
yeah, right.
septum.
Well, I feel like this is a classic example of people just trying to be different. I mean, this is such a thing in our industry where
like
someone
like a niche.
They want to stand out and like, oh, I do the total glands, I can't think of the word, contouring for your neck, and like it's so new. And I'm just like, no, please don't do that. Yeah. Okay, next, increased facial fat grafting. So this one I'll give a maybe. Of all of them, I think that this one was, and this is the only one of all of them that I was like, okay, maybe. So again, we're back on fat grafting. I don't know. I don't do facial fat grafting. It's not because I don't do fat grafting, because I do. I use it for a few applications. But my one gripe about fat grafting is it's a little bit less predictable than other surgeries. And on your face where it's so visible, like I just don't like unpredictability, and I don't like patients having to have like a lot of touch-ups or stuff. And I mean, that is a risk with the facial fat grafting. And so I kind of stuck to the more traditional stuff, like, the classic fillers, Sculptra, that kind of stuff for that application. I don't think it's crazy if you want to get it. I really don't. I mean, I wouldn't grieve.
Yeah, because you said it's lasts forever, right?
It does, yeah. Well, whatever it takes lasts forever.
Yeah.
Because you inject it, some gets reabsorbed, and some of it stays. Hopefully, like 80% is kind of like your target.
Versus like filler,
Yeah, I mean, it all
goes
stays,
away.
but then it dissolves, right? Yeah. So I get it. I mean, I think that it's not a bad thing at all. I just choose not to do it because, it's just not my favorite. I don't know. I just think that I like really predictable stuff.
Right.
And that's a little bit less predictable. So, okay, next one, a decrease in non-surgical skin tightening. So that would be things like lasers and like Morpheus microneedling. I don't see that happening. Those have been on the rise. They tried to cite some article that was claiming there's been a lot of problems with Morpheus 8. I hadn't heard that, and I'm going to have to do a little bit more deep dive into that. We haven't had any issues. It probably comes from the fact that the Morpheus released a new handpiece that's more aggressive. It's more for body skin tightening. And it is possible to crank that machine up high enough that it could potentially give you some minor issues. I did a treatment of Morpheus, and I told them to crank that thing up as far as they could. And it was spicy, but I mean, I was fine. I had zero problem.
There's like a lot of like stuff going around on social media with like girls getting like laser treatments, and it's like their skin's like falling off.
Yeah, totally. That's what it does. You should do one time.
But like it looks like really painful. So
It's not.
So I think I think that's why they're like, there's like nobody wants to do it.
So there's like different layers. I'm sorry,
like
different.
Your skin didn't fall off like that, did it?
I mean,
Did it
sort
look
of.
like, it looks like some
Okay.
of these girls
All
look
right.
like they got like burned.
Nuked. Yeah. Okay. So I would class these into three different
gross.
levels. Okay.
Yeah.
And I'm going to use Cyton as the company. There's other companies out there, but they're all sort of equivalent, and there's different levels of the laser. So like the entry one would be like Moxie. That's the one that Kim K talks about. And I like Moxie. We don't have it. We've thought about getting it. The one we have is the next level up, which is Halo. So with Moxie, if you get a Moxie treatment, you might have a day or two of redness, and that's it. So it's a low-level treatment. Yeah. So low recovery, but the results are more subtle.
Right.
Then there's Halo. I love this one because it's pretty intense. Like, it'll give you a really, really good treatment.
So like you came to the studio one time and you said that you had gotten
How'd I look?
a treatment. You were just red.
Yeah, but probably I was pretty far out. I would not do a Halo and then come on the show in at least 3 or 4 days, because it does make you look odd. Like your face, it looks like you got attacked by hornets or something. Like your face is swollen, it's red, like it's peeling. There's like oil extruding from your skin. I mean, it's not painful. In fact, it just looks painful. Yeah, it's not painful. I don't find. Even like a pretty heavy treatment like Halo,
it didn't hurt to like wash your face with water like in the shower.
It feels weird, but like I wouldn't say it hurts.
Okay.
It's a little spicy when you get it, and the real spice comes about an hour afterward when your skin's like, whoa, what just happened? And you're like sitting in front of the air conditioner, like cold air, please. Mm-hmm. But after the fact, to me, it's just more like there's oil on your skin's peeling. It's more of a nuisance than pain.
Okay.
But that one's like 5 or 6 days. Okay, so to me that's like the middle level, and to me the most popular. Like you get a lot of bang for your buck, but the downtime is manageable. And then the next one, at least in the Cyton family, is TRL. Now TRL, we don't have this machine, but probably will be the next one we buy. The results from TRL are freaking unbelievable. Like it's just bonkers how it can just erase lines in your face.
Yeah.
But it's like 30 days of downtime. Like we did a segment one time. It was one of the Real Housewives, and she didn't say what she got, but I know for a fact that she either got TRL or an equivalent, because like her face was like falling off.
Yeah.
And she was like, what did I do? Well, I mean, that's the surgeon, or maybe, well, that one has to be doctor. That was the physician's fault for not telling her it was going to happen. You got to prep people for like, this is like intense. So anyway, people may be seeing that super heavy treatment and people saying, oh my God, I'm 2 weeks out, my face is a wreck.
Right.
But, just get the one that you can work with. I mean, yeah, doing 30-day downtime is tough. That's why we haven't bought the machine. The results are amazing, but not a lot of people will do it. So I just don't see that happening. Yeah. And then the last one, they said that 360-degree tummy tucks are going to make a surge in 2026. So I call this around the world or belt lipectomy. It's basically when you do a tummy tuck, but then you have loose skin on your backside and you do it, but you do it all in the same surgery. And I will not do these. I just won't do them. Like, one, they're too morbid. Like, it's too much surgery at once, in my opinion. Plus, it increases your risks.
Yeah.
Because like it's a much longer incision, much increased disruption of tissues, disruption of blood flow. Like, people come in and ask me about it because you get a lot of people that want it because of things like Ozempic and GLP-1s where they can lose a lot of weight and suddenly they actually need it on their back. It's not just like I had a baby or two and I want to fix my tummy. But I make them break it apart. I'm like, look, I'm not doing it all at once. Like, it's just not worth it. Like, it's too risky. And if people don't want to have surgery with me because I think something's too risky, I'm fine with that. Like, they can go down the street and do whatever.
Yeah.
But I just don't see that. I just don't see that that's
They
making
didn't
a
talk
huge-
about lifts, like how people, like, since people are doing like Ozempic more, like getting like fixing their
Dude, totally.
arms, their
We've talked
legs,
about that.
like
I'm doing that. That's happening right now. I mean, I do.
But I thought that they would say that for like the top.
Oh yeah, that's what I would say. Yeah, and
Yeah.
I forgot to mention. That's really smart. So I would have said that one too. I put on the spot and I'm like, oh, what are the trends? I didn't even think about them. That's absolutely the thing. Yeah, 100%. And I'm doing that right now. Yeah. So.
Yeah.